My name is Kgomotso Mathabe. I am a urologist, a lecturer, and a researcher in Pretoria in South Africa. I work at a state hospital as well as a local university. The intersection of these roles has also led to me being the target of cyber criminals who have used my image, my voice, and exploited the work that I do in an online phishing scam. The use of AI to misrepresent science and scientists is a growing trend, enough that it has become a topic of articles in the top science journal, Nature, in an article by Linda Nordling, as well as in the conversation by Nomalanga Mashinini. I'd like to share some of the work that I do with you. I'd like to tell you a story about a patient. Let's call him Mr. X. Mr. X was a patient who presented to our hospital with prostate cancer. Prostate cancer is typically a condition that affects older men in their 60s and above, and it becomes more prominent as men become older. Mr. X was unusual for our geographical location and socioeconomic circumstances. Mr. X presented with cancer still localized to his prostate, still contained within the prostate. The majority of patients that we serve often present with cancer that has already spread outside of their prostate and reached other parts of the body, thus making it incurable. Mr. X was offered the options of radiation therapy and surgery. He was fit enough for surgery and opted for that. Had he not been fit for surgery, or had he had widespread disease, we would have offered him other treatment options which would have been meant for the control of symptoms, even if we were not offering cure. However, for Mr. X, we performed his operation and his prostate was successfully removed. He was discharged to his family. At a follow-up visit, we found that all of the cancer had been removed. He was thus cured, until, that is, he presented a few years later to the hospital unable to walk. He had developed a complication of prostate cancer known as spinal cord compression, which leads to paralysis as well as loss of control of the bowel and bladder. What is cancer? Cancer is a condition in which the cells of the body no longer respond to the normal mechanisms that are meant to control them. The structure, the function, the behavior become disorganized. Cancer is very much like the school bully, who, if he did ever read the school code of conduct, has decided to chuck it out the window. Initially causing mayhem in their own classroom, but over time developing clones and copycats in other parts of the school doing the same. Harassing classmates, ignoring teachers, destroying school property. These bullies do not adhere to the rules and pay no attention to authority. This is what cancer cells do. They overgrow in the organ of origin and over time begin to encroach into the surrounding structures and in time also dislodge and colonize other parts of the body, spreading the disorder and mayhem. This process is called metastasis. Historically, doctors have recognized 4 ways by which cancer spreads across the body. These are transcoelomic, contiguous, hematogenous, and lymphogenous. I know those are some really big words, but I will break them down for you. I believe that there's a 5th mechanism by which cancer spreads across the body, and that this has been right in front of our eyes all along. In the past, when doctors and scientists have studied the way in which cancer spreads, we have noted 4 routes. Today, I'm suggesting that there is a 5th route. Much like passing white light through a prism and seeing only 4 colors, I am suggesting that there is a 5th color which scientists and doctors have overlooked. The literature is replete with evidence of this. Curiosity, time, experience, as well as advances in technology allow us to understand our world better. I believe that we have gained enough experience in treating patients with cancer, that we have understood better what happens in the mechanisms of cancer spread. I believe that technology has advanced such that we can study the nerves better, and that with advances such as magnetic resonance neurography and AI-enabled digital histology, we can study these nerves better. It is now time for us to step back and look at the bigger picture. It is time for us to connect the dots. Today, I propose that we name this new way of seeing neurogenous metastasis. I suggest that it is time for doctors and scientists to not only look, but to also see. The term neurogenous metastasis fits in perfectly with the other words that describe spread within the body. More about these 4 ways of cancer spreading in the body. Some cells occur in body cavities, like the chest or abdomen. If cancer occurs in the body cavity and spreads within the body cavity, we call that transcoelomic spread. All cells have a blood supply. If cancer cells hop onto nearby blood vessels and hop off at distant sites, we call this hematogenous spread. All cells have a neighbor. If the cancer cells overgrow and start to encroach onto their neighbors, we call this contiguous spread. All cells have a lymphatic drainage. If cancer cells prefer to spread through the lymphatic vessels and the lymph nodes, we call this lymphogenous spread. All cells have a nerve supply. We call this nothing. I suggest that as of today, we start calling this neurogenous spread. The nervous system consists of a central nervous system, which is the command center of the body, which consists of the brain and the spinal cord. It also consists of a peripheral portion, which is made up of the electrical wiring that supplies the whole body. Nothing happens in the body or to the body that the nervous system is not aware of, including cancer. The discipline of urology is well positioned to lead the exploration of the concept of neurogenous metastases for the following reasons. Urologists treat conditions of the prostate. The prostate occurs only in males, who make up half of the world's population, and 1 in 10 males will develop prostate cancer. If prostate cancer spreads to the spine, it typically affects the lower spine. Is it then a coincidence that the nerves that supply the prostate begin and end in the lower spine, in the lower back, covering a distance of a mere 10 centimeters? In order to confirm prostate cancer, we take biopsies, and sometimes looking at these under the microscope, we see evidence of cancer cells entering the nerve fibers that are found within the prostate. This is called perineural invasion. And interestingly, this was present on Mr. X's biopsy. Prostate cancer has been shown to spread along the nerves on MRIs. And this is also then, the nerves on biopsy have shown the presence of prostate cancer within them. And finally, cancer, including prostate cancer, produces a protein which entices and induces the surrounding nerves to sprout new fibers that grow in the direction of the cancer. This is how nerve growth factor was first discovered by the 1986 Nobel laureates in the category of physiology or medicine, Rita Levi-Montalcini and Stanley Cohen. Back to Mr. X then. Mr. X was treated according to the guidelines. His prostate was removed in its entirety, and because the cancer was still contained within the prostate, the surgery was curative, yet he still went on to become paralyzed. A fellow researcher in the Department of Humanities here at the university doing groundbreaking research tells a story of how both her maternal and paternal grandfathers developed prostate cancer. Both of them went on to develop spinal cord compression. In the end, both men were paralyzed, unable to walk, and with no control of their bladder and bowels. When somebody has no control of their bladder and bowels, they have to wear nappies. This situation causes great distress and financial distress to families and to the patients. It crushes a man's dignity and spirit. I wonder if an appreciation of the concept of neurogenous metastasis might not have resulted in different outcomes for these men. What about our future patients? Is there anything that we can see at the time that we diagnose prostate cancer that might lead us to be able to predict or anticipate future spinal cord compression? And if there is there anything that we as treating doctors could do differently? Is there anything that we could ask our patients to do differently? Are there things that researchers could do differently? I believe that there are. For us as treating doctors, if we see at the time of diagnosis that there are cancer cells that are entering the nerves of the prostate of the patient, this should serve as a red flag for us for the possibility of future spinal cord compression, and these patients should be followed up more closely from the beginning. We should also warn our patients about the signs to look out for that spell the possibility of spinal cord compression. These include tingling in the feet, numbness in the feet, pins and needles, heaviness of the legs. Our patients should know that should these symptoms present, they must present themselves to hospital as soon as possible, including by ambulance if necessary. We should also educate our emergency service providers that a patient in the community who presents with these symptoms is as much of an emergency as a pregnant woman who starts to have contractions, as a young child hit by a car, as an executive who has chest pain and collapses. Why this insistence on resource mobilization for seemingly a lost cause? Because if a patient presents with these symptoms to hospital within 12 to 24 hours of the symptoms starting, we can give them medication, we can offer them radiotherapy or surgery to the lower back to prevent them becoming paralyzed. If we do this, they will then retain their ability to walk, they will retain control of their bladder and their bowels. This is not a lost cause, this is a most noble cause. As treating doctors, we should also get together to define guidelines for how we follow up these patients. We should also get together with other scientists to design research that allows us to further study the concept of neurogenous metastasis, in the hope that in doing so, we might be able to predict spinal cord compression, or even better, to prevent it. It is imperative that we do this for the sake of the dignity, mobility, and independence of our men with prostate cancer. Thank you.